Well, silence is probably one of the trickiest themes to write about because silence is something that's hard to observe. It's silence, right? It's something that is not mentioned a lot in a lot of the readings that I've done because it is difficult to write about, record, observe. But yet I noticed it over and over again, and there were many times that silence seemed to be the most appropriate nursing intervention. For example, if there was a very emotional moment, say a patient had just received very devastating news about a diagnosis, their cancer had progressed, there are no words in the human language that can actually match the intensity of that moment. And so silence, just being there in a silent presence, seemed to be the most appropriate and effective nursing intervention. Patients who are very confused or agitated, adding more words and talking seems to just exaggerate that confusion. And just simply being there and being present, sometimes combined with an appropriate touch, sometimes just being in the same space with that person and actually being present with them in their experience is the most appropriate intervention. Patients who are speaking different languages, perhaps, again, if you didn't have their language, adding English to the mix is probably not going to help, but being there in a silent moment. And another interesting time is when people have had a long relationship, a nurse and a patient have journeyed together for many times that they've been admitted, and they've known each other well and they've shared a lot, and the patient may be near the end of their life, then perhaps silence is the most effective, the effective communication tool, because the words have run out. There's nothing more that needs to be said. There's nothing more that would add to the relationship. And there's a comfortable silence between the two that is probably the richest communication possible. So there's a lot of power in silence. I think there's a lot of maturity needed to know when to use it and how to use it. And a lot of the nurses in the stories told me about times that they learned to use it sort of by accident. Maybe they didn't know what to say, so they didn't say anything. And then later the patient would say, "Thank you so much for being there with me in that moment of crisis." And then they realized, wow, being silent and being there is sometimes the right thing to do. And a lot of lay people who have read the silence chapter have found it was very helpful to them, because I think a lot of times when we are visiting with someone who's very sick or there's a crisis, we don't know what to say. And so we don't necessarily even go to visit because we don't know what to say. But they said that you give me permission to say nothing. And sometimes that's okay. And sometimes that's even better than okay. Sometimes that's really the best thing that you can do.